Good afternoon, everyone. Hi, I'm Mary Ann Joyce, a physician um, liaison for OHC. Welcome to our June lunchtime learning. We have Asha Rone today, who's the Director of Health Equity and Engagement at the Cancer Support Community. Um, Asha is a licensed master's social work and is passionate about advocating for social and emotional support. And she's going to talk to us today about the lifelong journey of cancer survivors and how the community can help. So take it away,
All right.
Asha. Sorry, by the way, we are recording this, so I will send out the recording when I receive it. Okay, go ahead.
All right. Well, thank you, everyone. I'm glad to be here. So I know lunchtime is precious. I'm going to try to make this worth your while. For those of you I haven't met, again, I'm Asha Rone. I oversee mission delivery in our health equity efforts here at Cancer Support Community in the tri-state area. And this work, just walking alongside people that are going through their cancer journey, it really is very meaningful. We are currently in June, which is our National Cancer Survivors Month. So I want to start by asking you to pause for a second before we get into any of this content. Think about someone in your life who has been touched by cancer, whether it's a parent, a sibling, a friend, a patient you saw last week whose face you still carry around. Most of us on this call have that person. I know that I certainly do. That's really what today is about. It's not just the clinical picture of survivorship, but the full human picture. So thank you again for being here. Let's jump right in. I want to start with the word itself because it is complicated. Survivor. I've had participants come into our building who love that word. They wear it like it's a badge, it gives them strength, it's a part of their identity. And I've had participants who genuinely cannot stand it. They'll say, I don't feel like a survivor. I feel like someone who's just trying to get through this week. And both of those responses are completely valid. Here at CSC, we try to follow the person's lead. So some people prefer the word thriver. Some people prefer the word warrior. Some just want to be called by their name and not have a label attached at all. What matters is that survivorship isn't a moment. It's not a finish line you cross. It begins the day someone hears the word, you have cancer, and it continues for the rest of their life. Here's the thing I want to make sure that lands for the clinical team that's on the call today. Finishing treatment is often one of the hardest parts begins. I know that sounds counterintuitive. Treatment ends, the patient rings the bell, everyone celebrates, and then they go home. And suddenly there's no schedule, there's no medical team checking in every week, there's no clear sense of what to do next. We hear from people regularly who just finished treatment and feel completely lost, not because anything went wrong medically, but because the structure of their life they were used to completely disappeared and nobody told them what to do with all the fear and uncertainty. That transition point right out of active treatment is one of the most disorienting experiences a cancer survivor can face. And it's one of the biggest opportunities for your team to make a true difference. When you look at this slide and really let those numbers sink in, beyond the statistic, you start to understand just how many people are walking around the community, sitting in waiting rooms, working at hospitals, who are living with the lasting effects of a cancer diagnosis. 1 in 3 Americans. That's not a distant public health number. That's personal. That's the colleague sitting 2 seats away or the patients you're going to see after this lunch call. And these numbers are continuing to grow. The good news is that people are surviving cancer at higher rates than ever before. We should celebrate that, but it also means the need for survivorship supports, long term follow up, and community resources is going to grow right alongside it. So, organizations like OHC and CSC, we have to be ready. That responsibility is real, and I think everyone on this call already feels it. Now I'm going to tell you about something important, and that's the reason I trust the information that I'm sharing today. So here at Cancer Support Community, we have something called the Cancer Experience Registry. It's a national research initiative run by Cancer Support Community. It's one of the largest patient reporting outcome databases in oncology. Tens of thousands of people who volunteered their experiences, their fears, their unmet needs, all to help understand what cancer survivorship actually looks like from the inside. This is survivors telling us their own words what they're struggling with. And at CSC, everything we design, every program, every workshop, every support group starts with what that registry tells us. When you look at the full picture of what survivors report, a pattern emerges. I think it's really important for a clinical audience to see. It's not one category of challenge. It's not just physical. It's not just emotional. It's not just practical. It's all of the above. And here's why that matters for your team. A survivor sitting across from you in an exam room might be managing all of those things at once while doing their best to appear like they've got it together. The exam room conversation is often the tip of the iceberg. What we see on our end is when people feel safe enough to be honest, it's everything that's underneath that. This slide we'll spend a little extra time on because I think it's where clinical teams and community organizations like ours can really strengthen each other. So let's paint a picture. Someone walks into one of our support groups, maybe 6 months after finishing treatment. They look great, their hair is growing back, their color is in their face, they're dressed very nice. And if you pass them on the street, you would never know. But they come in and they sit down, and within 10 minutes, they're in tears because they're terrified. Every time they feel something new in their body, because they can't sleep, because their relationship has fundamentally changed and they don't know how to talk about it, because their brain doesn't work the way it used to, and they're scared they'll never get it back because no one warned them of anything that was coming afterwards. This is what I mean by invisible suffering, and it is so common. The physical effects of a cancer treatment persist for years, sometimes for life. And patients frequently don't bring these things up on their own. They don't want to seem ungrateful. They don't want to be seen as complaining, or they should just be happy. They figure it's just something they have to live with, or they genuinely don't know what they're experiencing is connected to their treatment. What I would ask of a provider on this call is to ask the questions. Don't wait for the patient to bring it. A simple, how are you sleeping? Or has your energy come back? Or what's hard right now? What's difficult? Opens a door that patients won't open themselves. The opportunity in follow-up care is enormous. And you have a level of trust with your patients today that no one else on the call will have. So here's a paradox. We see it all the time. The world tells you to celebrate when your treatment ends. The family will throw a party. People saying you beat it. And outwardly, you're grateful, of course. But on the inside, you might be falling apart. There's a kind of grief that happens at the end of treatment that nobody talks about. The calendars are completely clear. The appointments have completely stopped. The nurse who knew your name, you saw them every Tuesday, who noticed when something was off, that relationship just ends. The structure that was keeping you moving forward completely disappears. And that's when the fear moves in. The treatment was doing something, it was fighting the cancer, and then it's the now what? What's protecting you now? What hypervigilance, the constant scanning of your body for the sign something is wrong, that's not irrational. It's a normal response to an extraordinary experience, but it can be completely consuming. We describe this to our participants sometimes as like the safety net has completely disappeared. And that's exactly when our phone rings. It's not during the treatment. During treatment, people are in motion, they have their appointments, they have the team, there's a plan. It's what happens after that. That's when isolation sets in. That's when anxiety begins to peak. It's when depression surfaces for the first time. And this is why peer connection is so powerful. There's something that happens when a survivor sits across from another survivor and gets to say, me too. Not a provider, not a family member, not a well meaning friend, someone who has actually walked that path and understands that terrifying road. It's the connection that helps to reduce the isolation in a way that nothing else quite does. It's the whole reason we at Cancer Support Community are even here, we exist. Another thing that we want to talk about today is the financial impacts of cancer is profound, and it affects the care and that shows up in the exam room, whether you or anyone says it out loud. So we most hear it referred to as financial toxicity. and the oncology researchers use all the time. And it's very accurate because it is very toxic. It affects the decision making, it affects adherence, it affects their mental health. And this is an enormous stigma around it. Patients don't want to tell their care team they can't afford the medication. They don't want to admit that they're in debt or have drained all their savings or stopped working. So they don't say anything. They just miss their appointments, they refill their prescriptions less, and they often seem withdrawn or disengaged. And sometimes that gets misread clinically. So when you see these patterns, consider, is the person struggling financially? Because there is help. There's community resources, there's navigators, there's organizations like ours that can connect people to different resources to help with financial assistance, transportation, even housing. There's a lot of resources for all of it, but we only know if someone asks. So think of it as like a referral to a community organization, not as a handoff, but as an extension of care that you are already providing in that exam room. So I want to be really clear. The support that we provide is evidence-based. It's psychosocial support, it's peer connection, it's physical activity, it's mindful practices, survivorship care planning, community belonging. All of these improve that quality of life, and in some cases can affect the health outcomes. And when I look at this list, I see CSC's entire program. We offer support groups for peer connection. We have licensed clinicians facilitating support groups. We partner with our wellness professionals and for nutrition and some of that physical activity. You are the clinical experts. What we are is the complement, the thing that happens between appointments in the evenings, on the weekends, when the patients go home and the medical team isn't there. Together, we can cover the whole person. So let's just bring us a little closer to home because I think it's easier when you can see a real life existence. So again, it's free for patients, for caregivers, for anyone that's been impacted by cancer. There's no income requirements. There's no insurance involved. So let's just think of a little story. I want to share something that has happened. We won't talk about any of the details, but we had a woman come to one of our support groups who was telling her oncologist for months she was doing fine. That was her answer every time anyone asked about it. She came to us because her neighbor mentioned it almost as an afterthought. In her first group session, she broke down completely. She hadn't slept more than a few hours in a week. She was terrified her cancer would come back, and she had never told anyone. Her family really thought that she was coping just fine, but she was not. And the support group became that lifeline for her. So it's just sitting in that room with people who completely understand what you're going through. So locally in Cincinnati and Northern Kentucky, we provide support groups for patients, the families, and the caregivers, along with educational workshops to help people understand their journey. We also offer programs focused on healthy living, nutrition, fitness, and mindfulness, as well as stress management and integrative therapies. Beyond that, we have other resources. We expand to like cancer transitions, which is like a 4-week program that's after treatment. We have My Lifeline for online connection and virtual support groups. And we also offer a helpline that's available after hours for patient insight to completely, to always improve our programs and to help that person as well. At the end of the day, our focus is truly empowering people with knowledge, strengthening them through action, and sustaining them through community. Everything we talked about today, the physical effects that persist long after treatment, the emotional weight of survivorship, the financial strain, the isolation, none of it gets addressed if it stays hidden, and it stays hidden when no one asks. So I started today by asking you to think about who in your life has been touched by cancer. That person, their full journey, not just their diagnosis, is what survivorship is really about. So cancer may be a part of someone's story. However, it should never be the whole story. And the work that you all do, the work that we do together is what makes the rest of the story possible. So thank you all. I really appreciate that this time was dedicated during your lunch. Thank you for joining me. I open this to any questions or hear if anything's resonating with you. I have put our contact information on the screen along with some QR codes for easy access, and you all are welcome to reach out anytime. We are here to be a partner.
Anybody have any questions they'd like to ask?
I did. That was really interesting. Thank you. Where are the support groups located? Is there like one main center area, or are they like around the tri-state area?
So most of our support groups right now are offered in Blue Ash in Northern Kentucky, but we do have some that are offered at like Christ Hospital, some that are offered hybrid. or virtual. So there's a few options.
Any other questions? Or comments? Okay, well, thank you so much for taking your time to join us today, and thank you, Asha, for providing us with this really important information.
Not a problem. Have a great
All
rest of your
right.
day.
Yep, have a great rest of your day, everyone, and I will send out the recording sometime this week. Thank you so much.